Hey, what's up? Welcome to the very first episode of Chronic Car Rides with me, Caleb. Nice to meet you. Welcome. I am stoked to have you here. I'm stoked to start the series. And I'm excited for what's to come. I think that it's going to be something that's really cool. And I hope it can start or facilitate or aid in discussions of any of the myriad of things that we'll be chatting about during these rides. I was initially going to start these as kind of just like a vlog in my house, like in the office, but I realized I spend more time in my car than I do anywhere else, so I figured why not take you guys on the ride with me. We're going to be chatting about a lot of different things within these car rides, because I think there's a lot of discussion that's currently happening around chronic illness, and there's a lot of discussion that needs to happen around the transgender community and the chronically ill community. Those are not related in any way. I just happen to be a transgender individual who has chronic illnesses. So I'm not saying that being trans is having a chronic illness in any way, shape, or form. Disclaimer or clarification, I suppose. A little bit of background before we get started. Again, my name's Caleb. I live in Los Angeles. I am a transgender male, meaning that I was assigned female at birth, lived up until probably the age of 21 as female, and then began my medical transition when I was 23, I believe. And I'm 32 now, so a little over 9 years. In August of 2020, I got sick. I got really sick. I was sick for about a month. And then after that, I wasn't ever really the same. So I got some testing done. I went to a bunch of doctors, a bunch of specialists, and January 2021, I was diagnosed with POTS, so postural orthostatic tachycardia syndrome and hypermobile Ehlers-Danlos. The doctors that I've been seeing about this, we kind of think that it's something like these diagnoses. I may have just gotten them in January of 2021, but the symptoms probably began much earlier than that, probably starting in college when I got mono, or Epstein-Barr virus. So there's correlation there between Epstein-Barr and developing POTS and EDS and things like that. This first go around, we'll actually be talking about being trans, and what the medical transition looks like, what my transition looked like, just with the knowledge that my transition may look different than your transition, or if you know somebody who's trans, like my transition may look different than theirs. There's no right way to transition. It's just dependent on that person's body and what works best for them. Similar to anything health related, it's not a one size fits all. So I am going to go run an errand real quick. I am at Best Buy because I realized I don't actually have a dashboard mount for my phone. So that seems like something that I should probably be using for this. So I'm gonna go pick that up, and then we will go get our blood work done at One Medical. All right, see you guys in a few minutes. All right, got my new little dash thing. So we'll see if it works. I mean, it was $20, so we'll see if it's one of those you get what you pay for. All right, so now let's ride. All right, so like I mentioned earlier, I am on my way to go get some blood work done. I have a membership at this this medical facility called One Medical. It's basically you pay an annual fee, and then you get access to their medical facility. So I've seen them for pretty much everything at this point. I've got a really great GP there. I get my blood work done there. They manage my medications, and if I need to see a specialist or anything that they don't cover, they write me a referral to a specialist who can handle it. It's super convenient. They take my insurance, and I don't have to drive 40 miles to my old doctor that I used to see. Because I did used to go to one of the directors of the gender health clinic at UCLA. That was really convenient, and it's something that I really recommend if you have access to a gender health specialist when you're first getting started with your transition. I highly recommend going to that specialist because they're able to, get you on the right dose of hormones. They're able to write referral letters for any surgeries that you need. Right now, I'm at that maintenance stage, so I don't need any surgeries. I don't need to change really anything. I just need somebody who's going to be able to get my labs done and then write my referrals. So that's why I've started going to One Medical. Typically with my lab work, I usually get it done every 6 months. We're doing it a little bit earlier than usual right now because I switched from injecting the testosterone to doing the testosterone gel. So it's all topical application now. So we're just doing the lab work to see where my levels are, and if we need to adjust the dose, the lab work will tell us that. For those who aren't really familiar with how hormone replacement therapy works, let's talk about that. I want to preface this by saying that this is my journey. That doesn't mean it's your journey. It will necessarily reflect mine, and this is primarily from a female to male vantage point. I am not familiar with what hormone replacement therapy or a medical transition will look like if you are transitioning from male to female. So again, this is my journey as a transgender male and kind of what I went through, or what I've gone through to get to where I am now. I started my transition about 9 years ago. I started at the LA LGBTQ Center. I think they changed their name. I don't remember. But basically I started at, I believe it was 100 milligrams of testosterone every 2 weeks injected. I did that for a few years before I started seeing Dr. Weimer at UCLA. As I mentioned, she's the gender health clinic kind of director or co-director, so she knows her shit. I was still doing every 2 weeks. After a couple years of that, we switched over to injections every week. So I was doing a 50 milligram injection every week. That helped with some of the more negative side effects of testosterone. When you're doing your shot every 2 weeks, or even every week, when you're doing your shot, your testosterone levels kind of like, there's a bell curve. So here's like the beginning of your shot. So like the day you do your injection, a couple days later, your testosterone levels will peak, and then they'll gradually decline until your next shot. So when I was doing my injections every 2 weeks, the highs and the lows were more prominent. So a couple days after my injection, I was feeling great. I was feeling balanced, my mood was stable, everything like that. When I got closer to my next shot date, I would crash. So I would find myself getting more irritable. My mood would turn on a dime. And so when Dr. Weimer and I swapped over to injections every week, it was a lot more stable for me, because there wasn't that insane high and insane low. It was a more kind of gradual type of fluctuation that worked better for me and literally anyone around me. I got my total hysterectomy in
Oh, God.
2017, I want to say 2017, 2018. I took out everything. If you get your hysterectomy, you have the option of preserving your ovaries or preserving one ovary so that you still have that kind of hormone maker, I guess. I opted to get everything removed, mainly because I have a history of developing ovarian cysts, and they're super painful and they suck and I hated them. So just to be on the safe side and nip those ovarian cysts in the bud and put a stop to them, we had everything removed. Once I recovered from that surgery, we switched from injections to androgel, so the testosterone gel. And that was fine. Like, I'm back on the testosterone gel, but I went off of it. I honestly don't remember the first time I went off of it. I think it was partly because I wanted to like wear a tank top outside. So we swapped back over to injections. So in 2021, I was diagnosed with hypermobile Ehlers-Danlos. And with that wound healing, the way that wounds heal on my body is not up to snuff. So I found that when I was doing my injections, I was developing scar tissue really quickly. And since I lost a lot of weight when I got sick in 2020, I didn't have the excess skin or the excess fat in my thighs to do my subcutaneous injections. So I've been doing my injections in my stomach. And getting scar tissue in your stomach is so painful. So like my belt was pushing up against the scar tissue, my clothes were pressing up against the scar tissue. When I would move, when I would sit, when I would try and exercise, everything was pushing up against the scar tissue, and it sucked. And I didn't, since I'm gonna have to be on testosterone for the rest of my life, since I had the hysterectomy, or at least some form of hormone replacement therapy forever, I didn't want to run the risk of getting so much scar tissue that I couldn't do my injections anymore, which is why we switched back over to the testosterone gel. So if you are starting out your hormone replacement therapy journey, or you've started the medical transition and you're trying to decide, okay, do I want to stay on injections? Do I want to stay on gel? Do I want to switch to one or the other? There are a couple of things to keep in mind when you make this decision. The first thing is always chat with your prescribing doctor. So whichever doctor you're working with for your hormone replacement therapy, always chat with them to see what their viewpoints are. Obviously, you know your body best, you know your health best, but they are also there to work with you. They may know of new treatment options, like there's the testosterone pellet. There may be pills, there may be patches, there may be something outside of like the more traditional injection or gel therapy options. So chat with the doctor that you're working with to determine, just kind of pick their brain, see what they like, see what they would recommend. So there are pros and cons to each of the options. So I'll start with the injections, what I liked about it, what I didn't like about it. We kind of already touched on that a little bit, and then we'll talk about the gel. So the testosterone injections, there are two modes of injections. So you can either do your injection IM, so intramuscular, which is basically like when you get a flu shot, or if you got the COVID vaccine, you're going to do your injection into a big muscle. So typically when doing testosterone, you're either going to inject it into your thigh or into your butt. There are always risks involved with injections, especially if you're going to be doing them yourself. I did my injections myself. I had somebody at the clinic teach me how to do the injection. And I think I got it done at the clinic. Ooh, it's a bumpy road. I think I got it done at the clinic like twice before I felt comfortable enough to do it at home. There are always going to be risks involved when you're doing an injection. You can nick a vein, you can, pull out weird and kind of like be sore for a few days. The biggest thing for me outside of the scar tissue I started developing was the shot anxiety. So if I had one bad shot, I would start to get anxiety for the next several shots. And with that anxiety, I would start putting off my next shot. So instead of doing my shot every week, if I had a bad shot, there would be times where I'd skip the next week, or I would wait a few extra days before I do my next shot. And if you're not consistent with your hormone replacement therapy, you do run the risk of, those mood imbalances. That was something that on the shot side of things, the injections, that was something that didn't work for me. The plus sides of doing the injections is you get more testosterone via injection. Like, your body is going to absorb it better than doing the topical applications. Depending on, it's kind of conjecture at this point, but you may see results faster than a topical application. That said, everyone's body is going to be different. Everyone's body's reaction to testosterone is going to be different. Some people start seeing results fairly quickly. Some people, it takes a while. It takes a few months. It takes a year. So the roots of testosterone therapy, let's say you had 5 people doing injections and 5 people doing the topical applications. They're taking the same dose. They start at the same time. You may see half the people doing the injections, seeing results faster, but you may see half the people doing the testosterone gel, seeing the same results in the same amount of time. So it all comes down to your genetics. It comes down to your body. So it doesn't really matter what type of hormone replacement therapy you're getting, whether it's injection or gel, or a pellet or a pill, or whatever option you choose. Really, it comes down to genetics as to how quickly you're going to see results. It also comes down to the dosage. So we'll kind of go into that a little bit. When I was doing injections, my dosage, I was taking 0.25 milliliters of testosterone every week. And that translated to 50 milligrams of testosterone every week. That is on the lower end of hormone replacement therapy. My body tends to metabolize medication fairly quickly, which is why we've stuck with this lower dose since I started. Like, I've been on what's essentially 50 milligrams of testosterone since I started transitioning. And as you can see, I'm still seeing results. I've still gone through all of the physical changes that come with hormone replacement therapy. And that dose works for me. My testosterone levels have remained fairly consistent since I started. The typical dose, again, dosage varies by person and by prescribing doctor. The typical dose is about 100 milligrams of testosterone, or 150 milligrams every 2 weeks. So again, it comes down to your body, your genetics, and your prescribing physician. Now that I'm on the gel, I'm prescribed 4 pumps every day, which I think is about 84-ish milligrams every day. I'm currently doing 3 pumps. So we're gonna get the lab works done and see where my levels are. If my levels are a little bit low, then I'll bump it up to the prescribed 4 pumps. But since I was switching from injections to the gel, I wanted to kind of ease the transition and make it a little bit easier for my body. So I started with 1 pump, went to 2 pumps. Now I've been doing 3 pumps, and I've stayed there because I've been comfortable at it. So again, we'll see what the results, what the labs show, and if I need to bump it up, I can bump it up. It's fine. Going back to injections, pros, it's consistent. It's easier to get. It's easier to get your insurance if you have health insurance. It's easier to get your insurance to cover it, and it's the mode of hormone replacement therapy that physicians are most familiar with, probably. Sorry, I've got to get a parking ticket. 2 seconds. Oops, almost hit that. All right. And I think with, oh, okay. You just ran out into the middle of the road. The majority of people going through their transition, the majority of people are probably doing it via injection. So there's kind of that sense of, sorry, somebody almost hit me. There's that sense of community around injections. So if you have questions about injections, or you want to see a YouTube video where someone is kind of walking you through how to do the injection, you've got that going for you. Downsides are, pretty much the things that I've already mentioned. There's that risk of having a bad shot. Nobody likes a bad shot. Like, they are not fun. There's a little bit more risk of pain with the injection, whether that's pain pain at the injection site, or muscle pain if you do IM injections. So keep that in mind. Honestly, for me, those were the biggest downsides. And the shot anxiety. So if you are someone who tends to be a little anxious around medical supplies, or getting a flu shot or anything like that, the injection may not be your best bet. So just something to keep in mind, especially if you get that shot anxiety and then you put off your next shot. So that's that. So now I am on the testosterone gel. So I put it on my shoulders every morning after I get out of the shower. That's it. So the pros for me, for the testosterone gel.
Sorry, my throat's a little sore.
Oh, I'm the worst Angelino with my plastic water bottles, but sorry. So pros for the testosterone gel, at least in my opinion, it's more convenient. It's something it's part of my routine at this point, part of my daily routine. Take a shower, get out of the shower, put the gel on, wash my hands, and I'm good to go. And I have noticed that compared to the injections, my mood and my behavior is definitely more stable because I'm getting a consistent dose of testosterone every day. So there's not that high and low that typically comes with the injection. Because I am applying testosterone every single day, I have that consistent application coming through, kind of working with my body a little bit better. So that's a pro. It's the same cost with my health insurance because my health insurance covers the gel and the injections. So it's the same price every day or every month. And my levels are, in the past, I mean, we're going to see where they're at now, but in the past, my levels have been more consistent on the gel than on the injections. So that's the pros. I guess another pro would be I don't have to do an injection anymore. So there's that anxiety has lessened and pretty much disappeared. So that's a pro for me. I'm not dealing with the shot anxiety. I'm not dealing with the scar tissue, the muscle soreness if I went too deep or didn't go deep enough when I was doing IM injections. So I really like that. The cons to testosterone gel, it's annoying. So if you're not good on keeping a routine or keeping a schedule, remembering to do this every day, like, may not work. If you have a partner, if you live with a partner, it can be a little tricky, especially. So what my wife and I do is we have separate laundry baskets so that, because my shirts come in contact with the testosterone every day. So I do my laundry separately because I don't want to risk that, her coming into regular contact with the testosterone gel. Because if somebody comes into regular contact with it, it's kind of like they're taking testosterone too. So if that's not something that your partner is interested in, then you have to be careful about them coming in contact with wherever you put the testosterone on. So that's a downside. For me, that's pretty much it. It's kind of annoying to have to do it every day. And I have to be careful about like skin-to-skin contact or her coming in contact with, my sheets that I sleep on or my clothes or something like that. Those are really the big ones. I haven't noticed, my changes. I'm nine years in, so like there aren't going to be a lot more changes coming through, but I haven't noticed any increase or decrease in facial hair or vocal tones or anything like that, comparing injection to the gel. So yeah, I mean, those are kind of the two modes for, the medical transition. Again, it really comes down to what works best for you. So think it over, do your research, talk with your prescribing doctor, your endocrinologist, whoever's going to be prescribing your hormone replacement therapy. And if you have any questions, feel free, comment down below. You can find me on Instagram. I'll put my Instagram handle down below as well. Yeah, I'm an open book. I'm happy to answer any questions you may have. So thanks for taking this ride with me. Time to go get stabbed with the needle. See y'all.